Can men get pregnant?
I take care of people with many identities, but
can men get pregnant?
Many women that can get pregnant. I do take care of people that don't identify as women. That
can men get pregnant?
Again, as I'm saying,
So let me just remind you, you testified to a moment ago. Science and evidence should control, not politics. So can men get pregnant? You're a doctor, I think.
Science and evidence should guide medicine.
Do science and evidence tell us that men can get pregnant, biological men?
A single question in a Senate hearing turned into a national flashpoint when Missouri Senator Josh Hawley asked physician Dr. Nisha Verma a blunt, 5-word query: can men get pregnant?
Thank you, Mr. Chairman. Since you bring it up, why don't we just start there? Dr. Verma, I wasn't sure I understood your answer to Senator Moody a moment ago. Do you think that men can get pregnant?
I hesitated there because I wasn't sure where the conversation was going or what the goal was. I mean, I do take care of patients with different identities. I take care of many women. I take care of people with different identities. And so that's where I paused. I think, yeah, I wasn't sure where you were going with that.
Well, the goal is just the truth. So can men get pregnant?
Again, the reason I paused there is I'm not really sure what the goal of the question.
The goal is just to establish a biological reality. You just said a moment ago that science and evidence should control, not politics. Absolutely. So let's just test that proposition. Can men get pregnant?
I take care of people with many identities, but
can men get pregnant?
Many women that can get pregnant. I do take care of people that don't identify as women. That
can men get pregnant?
Again, as I'm saying,
let me just remind you, you testified to a moment ago. Science and evidence should control, not politics. So can men get pregnant? You're a doctor, I think.
Science and evidence should guide medicine.
Do science and evidence tell us that men can get pregnant? Biological men, can they get pregnant?
I also think yes/no questions like this are a political tool. And
no, yes/no questions are about the truth, doctor. Let's not make a mockery of this proceeding. This is about science and evidence, and I'm asking you. You know, the United States Supreme Court just heard arguments yesterday at great length on this question. This is not a hypothetical question. This is not theoretical. It affects real people in their real lives. And you're here as an expert, called by the other side as an expert, and you've been telling us that you follow, right, you're a doctor, and you follow the science and the evidence. So I just want to know, based on the science, can men get pregnant? That's a yes or no question. It really is, I think.
I think you're trying to reduce the complexity of a lot.
I'm not. I'm trying to get, it's not complex. I'm trying to get to an answer, and I'm trying to test, frankly, your veracity as a medical professional and as a scientist. Can men get pregnant?
I think you're also conflating male and female with...
No, I'm not conflating male and female. They're two different things. There's biological men and there's biological women. And I want to know, can men get pregnant?
What you were talking about is biological...
You're not going to answer my question.
Biological males.
This isn't hard, doctor. Can men get pregnant? Yes or no?
Again, I would be more than happy to have a conversation with you that is not coming from a place of trying to be polarized and push.
I'm not trying to be polarizing. I'm trying to ask, I think it is extraordinary that we are here in a hearing about science and about women. And for the record, it's women who get pregnant, not men. We are here about the safety of women and science that shows that this abortion drug causes adverse health events in 11% of cases. That's 22 times greater than the FDA label, another fact you haven't acknowledged, and yet you won't even acknowledge the basic reality that biological men don't get pregnant. There's a difference between biological men and biological women. I don't know how we can take you seriously and your claims to be a person of science if you won't level with this on this basic issue. I thought we were past all of this, frankly. I can't believe we're still here talking about this.
I am a person of science, and I'm also someone here who's here to represent the complex experiences of my patients, and I don't think polarized language or questions serve that goal. I don't think they serve the American people.
It is not polarizing to say that there is a scientific difference between men and women, and I want this to be clear and for the record. It is not polarizing to say that women are a biological reality and should be treated and protected as such. That is not polarizing, that is truth. It is also, by the way, the United States Constitution, which offers unique protections to women in a variety of circumstances as women. And your refusal to recognize women as women and men as men is deeply corrosive to science, to public trust, and yes, to constitutional protections for women as women. And I think it's extraordinary that you would sit here and advance a political agenda that has been thoroughly discredited and rejected by the American people in this forum. And I'm glad we had this exchange because it is exceptionally clarifying. It is also in many ways quite depressing. I see that my time has nearly expired. I just want to thank the other witnesses for being here. Thank you for protecting women and children. Thank you for your valiant efforts. Thank you for following the science. And thank you, Mr. Chairman, for this hearing.
Senator, also.
What followed was not just an awkward exchange between a lawmaker and a medical expert, but a revealing collision between science, language, politics, and the lived experiences of patients across America. Hawley opened his time by returning to an earlier moment in the hearing, saying he had not understood Dr. Verma's response to another senator. He framed his question as a search for truth and biological reality. Dr. Verma hesitated, explaining that in her medical practice she cares for women and also for patients with different gender identities. She said her pause came from uncertainty about the purpose behind the question, rather than from confusion about medicine itself. The senator pressed again and again for a simple yes or no. He argued that science and evidence must control public policy, not politics, and that a doctor testifying before Congress should be able to give a straightforward answer. Dr. Verma responded that her work involves real people whose identities do not always fit neatly into political slogans. She warned that reducing complex medical and social questions to a single word can become a political tool rather than a path to understanding. If you want thoughtful breakdowns of moments like this, remember to subscribe so you never miss the deeper context behind the headlines. As the exchange grew more tense, Hawley invoked recent Supreme Court arguments over gender and medical care, insisting the issue was not theoretical. He said the American public deserves clarity, especially when laws and health policies affecting women and children are being debated. He repeatedly asked whether biological men can become pregnant, drawing a line between biological sex and gender identity. Dr. Verma attempted to explain that medical practice recognizes both biological factors and the realities of transgender patients who may retain reproductive capacity. She suggested that the senator was conflating different concepts and that respectful conversation requires more than a yes or no format. Hawley rejected that approach, saying he was testing her credibility as a scientist. Dr. Verma closed by saying she is both a person of science and an advocate for the complex experiences of her patients. She argued that polarized language does not serve the American people and that medical care should be guided by compassion as well as evidence. The hearing moved on, but the clip spread rapidly across social media, celebrated by some as a defense of common sense and criticized by others as a public humiliation of a physician. To understand why this moment resonated so widely, it helps to look beyond the personalities involved. Medicine has long distinguished between biological sex, determined by anatomy and chromosomes, and gender identity, which describes a person's internal sense of self. Advances in reproductive technology and the visibility of transgender men who retain uteruses have challenged older language. Some doctors now use terms like pregnant people to include those patients, while many Americans hear that phrasing as a denial of basic biology. The political stakes are high because definitions shape laws. Rules about women's sports, military service, prison placement, and health coverage often depend on whether policymakers prioritize biological categories or self-identified gender. Court cases working their way through the system will decide how far either approach can go. That is why a seemingly simple question in a committee room can ignite such fierce reactions. Hawley's supporters say he exposed how ideology has crept into medicine and universities. They argue that if experts cannot state obvious biological facts, ordinary citizens will stop trusting them on more complicated issues. Critics counter that the senator created a spectacle rather than seeking understanding, and that doctors should not be forced to deny the realities of transgender patients to satisfy political theater. For viewers at home, the scene illustrates a broader breakdown in how Americans talk to each other. The hearing was supposed to be about health and safety, yet it became a symbolic battle over language and identity. Both sides claimed to be defending science, but they meant different things by that word. Science can describe chromosomes and organs, yet medicine also deals with mental health, dignity, and access to care. Moments like this remind us that public hearings are not only about gathering information, they are stages where cultural conflicts play out in real time. The challenge for citizens is to separate heat from light, to listen for facts without ignoring human stories. If you appreciate reporting that slows the argument down and explains what is really at stake, subscribe to the channel and join the conversation.